Welcome to this video. I'm feeling quite encouraged today because a lady in the United States has said that vitamin D status can help protect against COVID-19 and the complications of COVID-19, or at least it's likely. Let me quote her words. The evidence is becoming quite compelling. The evidence is becoming quite compelling. Now, this lady is JoAnn Manson and just happens to be the professor of medicine at Harvard Medical School. So it's wonderful that this professor has read the material that I've read and has come to the same conclusions. Now, that's the bottom line of this video. Now, if you're bored with vitamin D videos, you can switch off now. That's the bottom line. That the Harvard professor has said that the evidence is becoming quite compelling, that good vitamin D status will help to protect against severe vitamin D. Well, vitamin D status will protect against probably COVID-19 infection, but more importantly, the complications, severe COVID-19 disease, and particularly as we'll look at the severe inflammatory reaction called the cytokine storm. So vitamin D status is important. So that's the bottom line of this video. If you want to switch off now, that's fine. But if you want a little more, then we'll go on to that now. Now, does vitamin D protect against COVID-19 is the question. And this is published on Medscape, which is a very reputable site. So don't take my word for it. Listen to it firsthand. The video is there. So the evidence is becoming quite compelling. And as well as being professor of medicine at Harvard, she's a specialist in a division of preventive medicine at Brigham and Women's Hospital in Boston, Massachusetts. So she's into preventative medicine as well. So am I, but she's a professor of it. That's the difference. I'm just a hack teacher. But it's good to get people reading. The point is she's reading the same material that we've been considering for some time on this video. And she's coming to the same conclusions. And to me, that's remarkably reassuring. Now, she points out in her talk that what's already known about vitamin D status, well, it's important for bone health. And cardio, that's the heart, and metabolic, that's the whole metabolic processes going on in the body. It's important for all of those physiological processes. And we also know it protects against colon cancer. It's implicated in multiple sclerosis, all sorts of things like that. Now, the reason I stumbled there was I was thinking, I remember that someone emailed me and said, you're pronouncing vitamin wrong. Now, I've spent a little time in the States, not much, but I believe vitamins in the States is pronounced vitamin. So in the States you would take vitamin D, and in the UK you would take vitamin D. Believe me, it's the same molecule. It's exactly the same thing. So yeah, I pronounced vitamin wrong. Sorry about that, but there you go. But we all do over here, so we can't help it. So Professor Manson is saying vitamin D status may be more important now than ever because it's probably linked to the risk of developing COVID-19 infection and the severity of the disease. So she's come to the same conclusions that I have. Innate immunity boosts immune function against viral illness. So vitamin D is important for innate immunity. Now, innate immunity is the form of immunity that works against a wide variety of potential infections, as opposed to specific immunity, which only acts against one particular virus or bacteria. But she's saying it boosts innate immunity and boosts immune function against viral disease. And of course, this is a viral disease. So that is exactly what we want. Excellent. Now, it also has an immune-modulating effect on this talk. Now, modulation means making the immune system work harder or making the immune system work not so hard. Now, this is important. So the immune system is actually it's amazing. And it can be absolutely ruthless and vicious by eradicating a virus or a bacteria from the bacterial infection from the body. But if it goes wrong, it can also damage the body itself because it's such a vigorous response. It's such an amazing response. So it needs to be modulated. And of course, well, not of course, but it's true that in the body we have different white blood cells, lymphocytes, for example. And we have suppressor lymphocytes and we have helper helper T lymphocytes. It's the helper lymphocytes that are affected in HIV infection. But we also have suppressor lymphocytes that damp down the immune system. So we have cells that boost up the immune system, and because it's such a potent thing, we have cells that dampen it down as well. And vitamin D status is important in this immune modulating effect, because what we want is just the right amount of the immune response, and then when it's finished we want it to switch off or to down-regulate, and that's what this is doing. It's immunomodulating. It's getting it to just the right level for just the right moment in time. So immune modulating effect of vitamin D. And vitamin D can lower inflammation, as we know. And this may be relevant to the respiratory response with COVID-19 and this cytokine storm. Now, cytokines are chemicals released by cells. Cells. Kine means movement. So cytokines are released by cells and they affect other cells. So cytokines are released by some cells, and that then stimulates the inflammatory immunological response in other cells. But of course we want just the right amount. So if the immune cells are releasing lots and lots and lots of cytokines, they're stimulating lots and lots of immune response, thereby they're stimulating lots and lots of inflammation. And we can get inflammation all over the body where we don't want it. And that's this cytokine storm. And we know that's associated with complications such as death. Or it can be. So the correct amounts of vitamin D are modulating this effect. It's saying, well, come on, we don't want a cytokine storm. We don't want just the right amount. Now, there's evidence for this from laboratory cell culture studies in respiratory cells, in human respiratory cells, as well as animal respiratory cells. So this is known to be effective in the laboratory. And evidence that patients with respiratory infections tend to have lower vitamin D levels. So lower blood levels of 25 hydroxyvitamin D. So that's the vitamin D form that they're measuring in the blood. So patients with respiratory infections have lower levels of that. And there's some evidence from COVID-19 patients as well. So in other words, what we're saying here is we've known for a while that vitamin D status is important in respiratory infections, in that people who develop respiratory infections tend to have lower levels of vitamin D than people that don't develop respiratory infections. That's been known for a while, but now she's saying that there's mounting evidence that this is also true of COVID-19. Now, when I first started talking about vitamin D, I didn't know this. I knew that it was important in immunity, and I knew there was evidence that it reduced chest infections, but I didn't know that it was effective, that good vitamin D status was effective against COVID-19 specifically. I didn't know that. I inferred it was likely, but now the evidence that it's specifically acting to boost the immune system against COVID-19 is accumulating, as I suspected it would, and many others suspected it would. Now, she quotes some studies that we've looked at in this podcast, in this video before. Now, there's an 8-fold higher risk of having severe COVID illness amongst those who entered with vitamin D deficiency compared with those who had a sufficient vitamin D level. So this is the study in, I think it was Indonesia, wasn't it? So people with, they looked at the people coming into the hospital, and those that had more severe disease there was an 8-time higher risk of severe disease in those with the lowest amounts of vitamin D compared to those with the highest amounts. That's what it was. They compared the lowest with the highest. And the people with the lowest amounts of vitamin D had an 8-fold greater risk of having severe COVID disease. And we did look at that a week or two ago. Supplementation was associated with a significant reduction in respiratory tract infections. And we also noticed when we looked at this study that they needed many less antibiotics to treat the bacterial infections as well as the viral infections. And this study was showing a 12 to a 70% reduction in respiratory infections with vitamin D supplement. Why such a wide range? Well, people that already had reasonable amounts of vitamin D only got a 12% benefit. But people with low levels of vitamin D got a 70% benefit. And basically, what we have in this world right now, and there's a paper from Cambridge, I think, that talks about this. We actually have two pandemics. We have the COVID-19 pandemic, obviously, but we also have a deficiency of vitamin D pandemic that is silent, that is invisible, that is not recognised by medical authorities around the world. Because we know that in Central Europe, anyway, countries like the UK, Germany, France, Belgium, about 40% of the population are deficient in vitamin D. In the United States, it's 42% of the population are deficient in vitamin D. And of course, this greatly rises the darker the colour your skin is, because the vitamin D is made in exposure to sunlight. So if 40% of Americans and Europeans are deficient in vitamin D, can we conclude that 40% of Europeans and Americans have a suboptimal immune system? In my view, yes. Anyway, we're not talking about my view today. We're talking about Professor JoAnn Manson's views. I do hope I'm not misrepresenting her. Do watch the video for yourself, and if she'd want to talk to me, of course, I would be delighted. So anyway, the word direct quote from the article. So the evidence is becoming quite compelling. So that was interesting. So she said, encourage our patients to be outdoors and physically active while maintaining social distancing, of course. Exercise is important, sleep is important for immunity, and sun exposure is important. Now, the reason I look old is not because I'm old. I mean, I am a bit old, but that's not the reason I look old. The reason people look old is because the sun causes the skin to age. This is called photoaging. So if you look at parts of your body, so if you look at parts of your body that aren't exposed to the sun quite a lot, then the skin on your bottom, for example, will often look younger than the skin on the back of your hands because it's exposed to the sun less. So a lot of people have kept out the sun because it's known to cause photoaging. And of course, sunburn and excessive sun is also known to cause malignant melanoma. Now, I've seen quite a few patients die of malignant melanoma. It's horrendous. It can metastasize. It can spread. The tumour can spread from an initial site in just a few weeks and spread to other sites in the body. So anything on your skin that is changing or growing or becoming pigmented, get a dermatology person to look at it. I know in Australia they're very good at this. They have specialist dermatology nurses, and you can go in and they'll just look over you, and they're so experienced they can recognise anything suspicious very quickly. But that's associated with sunburn and excessive sun exposure, whereas we're often under sun exposed. So what I do personally is I put on a hat and I put some sun cream on my face, because that's old enough already, and get some sun on the rest of me that's not normally exposed to the sun. And that's the way I do it. So sort of get as much body exposure as you can. Find a modest place and get some sun exposure. That's what I do. And also we'll talk about supplements. Now, diet. Now, I agree with her on this, but diet for most people is only about 10% of the vitamin D that our body uses. About 90% comes from the sun. So read the food labels. That's simple. Read the food labels. See if it's fortified with vitamin D. Quite a few things are. Fatty fish, free-range eggs. And mushrooms are like us. It's absolutely weird. You've got these mushrooms. Completely different kingdom to us. I mean, in biology, you learn there's plants, animals, and fungi, don't you? The three kingdoms. So they're nothing like us, but yet they are in so many ways. It's weird. Mushrooms make vitamin D when they're exposed to the sun or exposed to ultraviolet. So a lot of commercial mushrooms that we buy are grown in the dark, so don't contain much vitamin D. But then if we put them in the sun, they'll make vitamin D even after they've been picked, as I understand the papers I've just been reading. But grown in sunlight, or mushrooms grown in ultraviolet light will have quite a bit of vitamin D. Now it's the vitamin D2 form. So D2 is the form of vitamin D. It's still vitamin D, but it's the form that tends to come from plants, whereas D3 is the sort you get in supplement tablets and comes from animals. So D3 will increase the amount of vitamin D in the blood more effectively than D2 will, but D2 will still raise it to some extent, so it's still good. Professor Manson then says it's quite reasonable to consider a vitamin D supplement. Now she points out that the recommended daily allowance is 600 to 800. But during this period of COVID-19, she says 1,000 to 2,000 is reasonable. Now 1,000 is 25 micrograms, and 2,000 is 50 micrograms. So 500 international units would equal 12.5 micrograms. So that's the recommended daily dose. But she's saying up it a bit during this time. Now, it's not for me to disagree with professors of medicine from Harvard, but there is evidence that most of us don't need multivitamins. Some of us do. If you do, that's fine, take some. But most of us with a normal healthy diet don't benefit from multivitamins. There's quite a few good quality studies that demonstrate that. So personally, I don't take multivitamins, and I don't recommend multivitamins to people with a normal diet. People that smoke and drink a lot of alcohol should take more vitamin B and C. But multivitamins, anyway. So anyway, if she says take multivitamins, then I'm happy for that. But personally, I don't take multivitamins. For most people, I don't think the evidence supports that. But I'm taking 2,000 international units of vitamin D, which is 50 micrograms. 50 micrograms of vitamin D. Now, this is good. Harvard are planning a randomized clinical trial with moderate to high doses. Now, she doesn't say the doses, but I would assume these are doses considerably higher than the 50 micrograms we've just talked about. So, there's a lot of things we don't know. That's why we need randomized clinical trials. In the meantime, she recommends it's important to encourage measures that will, on a population-wide basis, reduce the risk for vitamin D deficiency. So, quite happy with that. Always good to see that people are agreeing, especially people who know what they're talking about, like professors of medicine at Harvard. So that's encouraging. All right, I'm going to show you some posters from Liz in a minute. I mean, basically, less people are watching these videos now, so that's okay. That's fine. But I do feel that what I've talked about in terms of the vitamin D pandemic could potentially have has the potential to save one person's life, I believe. Not me, of course. It's you that's operationalizing this. I'm just a hack teacher. You're actually taking this out there into the real world and encouraging exercise and vitamin D and things like that. But I really do believe it could have saved someone's life. And if this video series has done that, then I'm more than happy. I'll go back and work a couple of shifts a week at the local hospital and dig my allotment the way I was doing before I started doing these videos. Anyway, we plan to carry on for now if people are still watching. But I'm not discouraged that they're becoming less popular. But you know, maybe next year when I'm digging my allotment, God willing, if I'm here next year, you know, I'll know that there's or working my shift as a staff nurse on A&E or whatever I'm doing. I'll know that there could be someone alive that wouldn't have been alive apart from these these videos, and if one person's benefited, I'm happy. Now, enough of that. Let's look at Lizzie's excellent infographics. Now, I just love infographics. Infographics gives you information without the use of language. And this is why I'm so grateful to Liz for doing these. Liz Gould, who's done these. And Liz Gould has been remarkably generous. So she's given her expertise to make these graphics. Now, they look simple. And if they look simple, that means they're actually really hard to do. It's hard to make things look simple. She's made them available. So you can go, I'll put a link, you can go to my website, you can download them. Can you make a poster of them, put it on the wall? You know, Liz has gone to all the trouble of doing these, so please use them. And put it on the wall of the staff room or whatever, and get people to look at them. That's why she's done them. So here we have the sun in the middle. Most of our vitamin D, 90% of the vitamin D comes from the sun. Yeah. You can read this. Less bacterial viral infections. More people with dark coloured skin in the United States have vitamin D deficiency compared to people with lighter coloured skins. So there's a whole gradation of us. These ones here, these whiter coloured ones, lighter coloured ones, they get sunburned quickly, but they make vitamin D more quickly as well. These darker coloured ones can be out in the sun all day and not get sunburnt, which is great, but they also produce vitamin D much more slowly. So there you go. Put it on your wall. And this shows what we were talking about, the immunomodulating effect. So we don't want this ARDS where the alveoli fill up with fluid, because that'll kill someone. And this is caused by the excessive immunological reaction. We want that reaction immunomodulated. So we don't want it too hot, we don't want it too cold. We want it in the Goldilocks zone. And vitamin D can help the immune system to be in the Goldilocks zone.